Hello, I'm Dr. Beena Mathagutti. I'm the Medical Director and Chair of the Emergency Department here at Pascack Valley. Today we're going to be talking about the signs and symptoms of stroke. So what are the signs of stroke in women? There are no differences in the signs of stroke in women versus men. Typical stroke symptoms include the loss or change in function of speech, facial droop on one side, weakness or numbness on one arm or one leg, loss of balance, or vision changes. For ischemic strokes, this occurs because of a blood clot in one of the main arteries that supplies oxygen-rich blood to the brain and causes the neurologic changes of a stroke. What is a pre-stroke? A pre-stroke, also known as a transient ischemic attack or TIA, occurs when you have symptoms of a stroke that last less than 24 hours. This can vary from a few minutes to a few hours, but it resolves itself. This occurs when a blockage similar to a full stroke happens, but it is brief and doesn't cause any permanent damage. What are the signs of a silent stroke? A silent stroke is much more subtle than a full-blown stroke, in which the damage to the brain are in smaller areas and impact less functional areas of the brain. Most people do not know they've had a silent stroke, but may see small changes in their memory, dizziness, balance, changes in mood, personality, and cognitive skills. Are there warning signs before a stroke? There can be warning signs before a stroke that present as a TIA. The risk of a stroke after a TIA is between 2% and 17% within the first 90 days. That is why it's so important. If you experience a TIA that resolves, you should still see your primary doctor, neurologist, or go to the ER for further evaluation. What happens after a stroke? After a stroke, some of the physical symptoms may resolve or be permanent. Commonly, these symptoms will improve with time and rehabilitation. The rehabilitation team consists of many different specialties, including the neurologist, rehabilitation doctor, physical therapist, occupational therapist, speech pathologist, psychologist, and case manager/social worker. Can a person recover from a stroke? Yes, with focused rehabilitation and medications to prevent future strokes, a person can recover from their neurologic changes. It may not recover 100%, but improvements commonly occur over time. What is the best treatment for a stroke? Once you notice stroke symptoms, it is of the utmost importance to call 911. If you are within 4.5 hours of when your stroke started, you may receive a medication to dissolve the clot if you do not have any contraindications to receive it, so the earlier the better. There are also other procedures for removing a large clot that caused the stroke if that is applicable. But, of course, the best treatment is prevention. This includes keeping your blood pressure and cholesterol down, watching your glucose numbers if you are diabetic, losing weight, exercising more, limiting your salt and alcohol intake, quit smoking, and being evaluated for atrial fibrillation. I'm Dr. Beena Mathagutti, Medical Director and Chair of the Emergency Department here at Pascack Valley. Thank you for watching.